Recently, the state of California delivered cease and desist orders to several genetic testing laboratories. Tonight on 3600 Seconds, we investigate the issues surrounding DNA testing. We go to Doug Batson, who's reporting on this story from the Oregon State University Library.
Thank you, James. We are always increasing our knowledge of life and how it works and pushing the boundaries of what is possible when it comes to the microscopic world of cells. The more we learn about the world and the life in it, the more tools we have to control our future. We investigate this debate as we look at DNA sequencing of our genomes and the knowledge and responsibilities that come along with it.
I never really knew my father. He wasn't around much. So I went to my doctor, trying to find some information about my medical history. So we did some genetic tests and, I went to the laboratory and there it was, clear as day.
Harrison Jones is a carrier for familial Down syndrome, a condition in which an individual carries mutant forms of the chromosomes 21 and 15. Mr. Jones has all the genetic information necessary to look, think, and act normal, but if he were to have any children, they carry a 1 in 4 risk of being born with Down syndrome.
Because of the tests, I now know something that I didn't know previously. I have to be a little bit more careful when I have kids in the future, and I'll definitely consider adoption now as a much more important option in my life.
Harrison went through an ideal situation, one that every American deserves. He visited his licensed doctor, who performed the test in the hospital lab. The procedure and results were explained during routine face-to-face doctor appointments, and he had both pre- and post-test counseling. That is what I want for the American people. You don't get that with these companies.
The companies Almost 23andMe, Genetico, and others all received cease and desist orders from the state of California for not being in compliance with health regulations and laboratory testing statutes. The state cited several complaints on laboratory procedures and a lack of counseling services as the basis for the cease and desist orders.
These internet companies are literally giving their patients a tube to spit in and then giving them this potentially life-changing information with absolutely no feedback. The patient has no way to put the information into context because there's no medical professional on hand to provide face-to-face reassurance or medical prognosis. Furthermore, what prevents an employer from sending in an employee's sample to be tested without the employee's consent?
John Schroeder, Director of Media Relations for Almost 23andMe, says otherwise.
California's cease and desist orders took us completely by surprise. At Almost 23andMe, we strive to do all we can to be compliant with both state and federal regulations regarding laboratory procedures. We know that we are not doctors, and we are not diagnosing any illnesses. We look for sections of the DNA that correlate to known illnesses or to known genealogical lineages, depending on what the client is looking for. These are relatively small sections of the incredibly large human DNA. Really, these are just markers and do not necessarily mean that the client has the disease in question, rather that they may have a predisposition only. Our services are akin to the automated blood pressure cuff at the pharmacy, and we are just another tool to be used for personal medical health. This technology has been around for years. We are just bringing these services to the masses. Because we're a web-based company, we can provide genetic testing for specific diseases, ancestry, or even just paternity testing for very low prices. If we required our clients to produce a prescription, this would increase our costs, not to mention the cost incurred by making an office visit in the first place. Our services are totally voluntary, so no insurance plan would cover it. Forcing these changes onto our businesses will result in increased cost to the customer with no additional benefit.
Although sometimes that small portion of the genome has huge effects. This is Miss Lucian. She's had 4 children, none of which have lived past the age of 7.
My husband and I lost 4 children to Tay-Sachs disease. They only had a 25% chance of inheriting the illness, but they all died. I can't tell you how much my family has lost to this illness.
Tay-Sachs, which causes rapid decline in mental and physical health, is a recessive disorder, meaning that both parents must contribute the gene in order for the trait to be expressed. There is no treatment for this fatal genetic disease, and most children affected don't make it past the age of 4.
The example of the Jewish community is one that I hope we can achieve in the future. But genetic testing to influence what a community wants in their children, that's a very fine line between eugenics and public health. I feel that we're getting too close to that very frightening line without first having a discussion about the responsibility and power that we have with this information. The science is moving too fast for our policies and laws, which are there to protect the people.
You can't tell a parent who's lost a child to an illness like this that they don't have rights to these services. Because of these tests, me and my husband have now gone on to have normal, healthy children who are now free from having to worry about this future for their children. We need these services in communities. With them, we have the potential to eradicate illnesses like Tay-Sachs and cystic fibrosis and Down syndrome.
The companies served with the cease and desist orders are continuing to do business as usual as the case winds its way through the court system.